Let's turn to the coronavirus pandemic, which clearly continues as the number of confirmed cases here in the United States is now approaching 2 million. The World Health Organization is saying that it had yesterday was the largest single-day rise in coronavirus cases ever. CNN national correspondent Erica Hill has the latest.
This is a triumphant moment for New Yorkers who fought back against this disease. This was the epicenter.
Today, New York City marks a major milestone, phase 1 of reopening. Construction can resume at more than 30,000 sites. There's curbside pickup for retail.
Oh, it's fantastic.
Some 400,000 people expected to be back on the job. Many commuting by train or bus. Subway riders reminded to wear a mask and try to keep their distance. The city also says it will conduct 35,000 tests a day. Overall, New York State and much of the Northeast trending down when it comes to new cases over the past week.
New Yorkers bent the curve by being smart.
The death toll is slowing across the country. Yet in a dozen states, deep red on the map, there is a sharp increase. Overall, new cases are up in 22 states, including Florida, which added more than 1,000 cases a day for 5 straight days last week. Arizona, California, Texas, and Michigan also on the rise. While testing is up, so is the number of people who are out. The TSA screened more than 400,000 people on Friday and Saturday, the most in nearly 3 months.
Where we've seen areas that have significantly increased have been areas that either, one, are very popular for a lot of people to flock to, or areas that opened up very early.
The CDC warning large gatherings, including protests, could put people at risk.
For me, the moment that I chose to protest, I was willing to die for this.
Officials urging protesters to get tested. A third of the new cases in Bucks County, Pennsylvania, announced on Saturday, were traced to one person who attended several beach house gatherings on the New Jersey shore. And at least 6 colleges, including Texas Tech and Auburn, reporting athletes who returned to campus have tested positive. Many were asymptomatic.
How many COVID cases will we accept to have our college football this fall?
Tough questions as Americans decide what they're willing to risk for a return to normal. It has been 100 days here in New York City since the first confirmed case, and an interesting modeling study published today in the journal Nature found that large-scale shutdown measures likely helped to avert 60 million additional infections here in the United States. The lead author from UC Berkeley saying, and I'm quoting him here, "I don't think any human endeavor has ever saved so many lives in such a short period of time," acknowledging the individual sacrifices, going on to say by using science and cooperating, we changed the course of history, Wolf.
Erica Hill, thanks so much for that report. Let's get some more now on the pandemic. I want to bring in our chief medical correspondent, Dr. Sanjay Gupta. Sanjay, there are things that people can do now. They can gather, they can eat at restaurants, they can go out and about. But even if they can, should they?
Well, I think everyone's going to have to evaluate this, based on their own level of risk. I mean, I think that you can reduce the risk to low, but not to zero. So I think it's going to depend. I'd say a couple things. One is obvious if you have symptoms or if you consider yourself someone who is vulnerable, going out and being in a place where the virus is spreading is probably not going to be a good idea. Second is, where are you going? If it's a restaurant, for example, is this a restaurant where you could sit outside? Is it not going to be that crowded? Are they taking this seriously? I think that'd be another consideration. If you're going to go eat with people, have they been taking it seriously? Because are they going to be a potential risk? So we're going to get through this, Wolf, but I think for now you have to think about these things a little bit more strategically, even for what would have otherwise been simple ventures outside.
What kind of advice, Sanjay, do you have for those who feel clearly uneasy about doing things they essentially haven't been doing now for the past 3 months?
I think, the basics, still apply here. And, I always preface by saying, we're going to get through this. This isn't going to be forever. But for now, the virus is still circulating. I'd get a good idea if it's circulating pretty aggressively in your community. If it is, I'd have a higher threshold for going out and doing things that aren't essential. If you have any kind of symptoms or if you're vulnerable again, you should probably stay home for the time being, or at least be very judicious when you go out. But then really be cognizant of your environment. I mean, we know that the virus is spread through respiratory droplets. People around you are wearing a mask. That's obviously going to make it safer. If you're going to go out to eat, Wolf, I think sitting outside, finding a table that's out of the way, not in a high traffic area, making sure it's a restaurant that takes us seriously, I think is going to be important. Again, everyone's going to have their own risk reward sort of relationship here. For me, I haven't been going out to eat at restaurants right now. I still think the risk is a little too high. I think we will get through this, but I think the numbers still have to trend downward a little bit longer for me.
Yeah, I'm with you, at least for now. Let's hope it gets better in the not too distant future. Dr. Sanjay Gupta, as usual, excellent advice. Thanks very much for joining us.